Hi, my name is Carrie and I am a pharmacist with Hawthorne Pharmacy. And this week for We Care Wednesday, we will continue to discuss heart health because February is American Heart Month. But with this video, I'm going to be a little more specific and discuss heart failure because this week happens to be Heart Failure Awareness Week. Now, heart failure is unfortunately a very common disease in the United States. It affects 6.5 million Americans and 900,000 new cases are diagnosed every year. And heart failure is a disease where the heart cannot effectively pump blood to the rest of the body, and this can lead to several heart failure symptoms. And it's very important for patients with heart failure to understand themselves, understand their bodies, and understand their symptoms. So when you think about heart failure symptoms, remember the acronym F.A.C.E.S. So F stands for fatigue, where you are more tired and have less energy than you normally do. A stands for activities limited, where you aren't able to either complete or enjoy the same activities you once did. C stands for chest congestion and cough. E stands for edema and ankle swelling. And S stands for shortness of breath and breathing problems. And these breathing problems can exist as breathlessness at night, and the breathing problems can also take place when you're at rest or if you're performing simple tasks like walking up the stairs or checking the mail. So those are the 5 primary symptoms of heart failure. Remember the acronym F.A.C.E.S. So F is for fatigue, activities limited, chest congestion and cough, edema and ankle swelling, and then shortness of breath. So those are the symptoms of heart failure. Now I want to talk to you about how to prevent yourself from getting heart failure. And these prevention strategies primarily involve managing the risk factors of heart failure, which include high blood pressure, diabetes, coronary heart disease, and obesity. Now, if you have high blood pressure, it's very important to take your blood pressure medications as prescribed and aim for a goal blood pressure of less than 130/80. The same goes if you have diabetes. Always take your diabetic medications as prescribed and check your blood sugar regularly to make sure you are at your goal blood sugar if possible. By controlling these 2 disease states, diabetes and high blood pressure, and controlling coronary heart disease, you can ultimately reduce your risk of developing heart failure. Now, the final risk factor for heart failure is obesity. This just goes back to maintaining a healthy body weight through effective diet and exercise. And if you do need to lose weight to maintain a healthy body weight, try to lose about 1 to 2 pounds per week until you reach that goal weight. Now, if you have any of the symptoms I discussed prior, and if you have risk factors for heart failure, be sure to contact your doctor to be screened for the disease. Getting tested and diagnosed early for heart failure, early in the disease course, will ultimately lead to better outcomes and more effective treatment options. I hope this information was helpful. Thank you for tuning in to this We Care Wednesday video. Be safe and have a great day.